Hi guys, I'm Dr. Shazadi and today I'll be discussing about the awareness on one of the very common symptoms called tummy upset. So what is tummy upset in medical terms? We call it as gastritis. With the name, as you can see, gastro is tummy, itis is some sort of inflammation that's happening. So if we understand that, you'll be much able to understand, why and what symptoms that can be caused. Because it's the inflammation of the tummy lining, so you can well imagine what symptoms it could cause. It could cause tummy pain, it could cause tummy upset, it could cause lots of belching, it could cause something like acid reflux, it could cause something like acid burning kind of sensation or burning kind of chest pain, after eating meals, things like that, or maybe feeling of fullness, and you might not have much appetite because of that. Not only that, in very severe cases whereby it's unattended and you've not sought any treatment with your local doctor, it can also result in vomiting with blood, as well as blood in the poo, in the stool, and that blood is generally and more likely it's darker stools. Now, let's go into what could be the causes of this tummy upset. In this video, I would like to discuss the most common cause of the tummy upset, which is due to actually a bacteria, and the bacteria's name is called H. pylori. So let's talk about in a simple words, in simple language, what does this bacteria do? 90% of the time, this bacteria results in the formation of a substances called ureases and proteases. And basically, they are the culprit and they cause lots of inflammation within the tummy lining. When this bacteria is releasing all those ureases, proteases, causing lots of inflammation in the tummy lining, it can then lead to formation of, maybe there is an increased risk of ulcer formation. And unfortunately, if the tummy lining is inflamed, it has the tendency to go a bit more abnormal, and then those cells we refer to as metaplasia. And if that happens, that can lead to further increased risk of the tummy cancer, which we call it as gastric adenocarcinoma. And also there is another association called mild lymphomas. So in an easy word, if this bacteria, this bug is sitting in your tummy, it's affecting your tummy, it will release certain things like ureases, proteases, and it will cause inflammation. And that inflammation will then result into probably ulcer formation, tummy upset, all the symptoms, and also increased risk of cancer in future. Now, it is very, very treatable and very easy to diagnose as well. The mainstay of diagnosis we do here in abroad is mostly by checking your stool sample, your poo sample, and we check for the stool for H. pylori antigen. However, there is also a breath test as well, which is not considered to be very reliable or sensitive. So if you are having all those symptoms, you can request a stool sample to be checked for this bacteria. And if the sample comes back positive for H. pylori, that this bug is actually, present, then a treatment's very straightforward. Your doctor will check your allergies, will check your medications, will check what medications you've been using, any recent antibiotics, any tummy protection tablets you are using, and then they will be able to advise something called a triple therapy. Triple therapy will include such as antibiotics as well as tummy protection medications. And once you've taken this triple therapy, there are various practices in certain countries. They do not, check for the eradication of this bacteria. They don't offer a repeat stool sample to check that whether this bacteria is being eradicated or not. However, in other countries, I've noted and I've seen in my practice that a further stool sample is requested and advised to make sure that this bacteria is eradicated and removed from your body. I hope that this is helpful and I hope that you can share it with your friends and family, because in my practice and in my experience, I see lots of patients with some simple tummy upset and tummy acid reflux and those kind of symptoms, which has been there for a long, long time. And whenever we offer a stool sample, we've noted quite a lot of H. pylori being the culprit and cause of the tummy ulcers. I will discuss in my further video other causes of the tummy upset, which we will cover it in the later video. Thank you very much indeed.